Center for Enhancing Democracy and Good Governance, CEDGG, a non-governmental organization that works in partnership with civil society organizations and communities, sought a holistic approach to understanding governance and human rights challenges in Nakuru, Baringo and Laikipia counties, with the aim to deliver long-term and sustainable systemic change at the local level. Since its inception in 2001, CEDGG has been advocating for access to information and quality service delivery at all levels of government. For the last 20 years, CEDGG has equipped communities, civil society, community-based organizations, non-governmental and faith-based organizations with skills to effectively participate in the budget-making process.
We work with these communities largely to build their capacity so that they are able to effectively engage in local governance and development processes. Most of our work now is at the county level, whereby we are able to identify these vulnerable groups, organize them for purposes of articulating their issues in county decision-making processes.
We develop their capacities, or we strengthen their capacities through training and coaching for application of our advocacy tools.
Following promulgation of the Constitution in 2010, citizens were accorded the right and mandate to participate in public finance, including budget making. Article 221 of the Constitution mandates a committee of the National Assembly to seek representation from the public with regards to the budgeting process.
We empower them to voice their concerns directly, and therefore what we do as CEDGG is to create that space for them to engage directly with the duty bearers.
If we have a community that doesn't care what government does, that creates a fertile ground for mismanagement of resources. But when we have people who are aware and take seriously their duty to follow up on what their government does, we see development happening.
Nakuru, Baringo and Laikipia counties are the pilot counties for a project that promotes transparency and accountability in decision-making. The project aims to enhance public awareness and understanding of governance processes and promote public participation and collaboration in governance processes. To achieve these objectives, CEDGG is working with civic educators in health, water and education sectors at the ward level. These educators work closely with budget champions that are in touch with the community at the grassroots level. The budget champions then engage the community directly, enhancing community access to budget information and increasing community participation in the budget-making process.
Their reports have been used as a feedback to now act on what they have recommended.
So civil society has worked, and especially in the research field, even collecting data or information from the public. They are the ones who have been helping us. They work together with the Department of Civic Education, and the public are also getting to appreciate what the county is doing.
CEDGG is strengthening the capacity of CSOs to engage with the government in a coordinated manner. To this end, CEDGG has spearheaded creation of county-level CSOs consortia that have been instrumental in monitoring service delivery and informing policy development.
If we look at the public participation when it started, around 2013, 14, 15, we were only doing public participation in sub-counties. When you're doing public participation at county headquarters, it can only attract few people. Through the partners and engagement with the civil societies, we're able now to advance to carrying out public participation in all the 55 wards.
CEDGG has been very instrumental in mobilizing the masses. In some instances, we have budget champions for specific wards who assist now to mobilize the community and help them to interrogate the documents. Further to that, they've also helped us in terms of distribution of budget documents.
And that's why, of late, they are getting more committed to even come without asking us for food, for transport, because they appreciate what the civil society is telling them from the point of view of the public.
CEDGG has successfully modeled strategies that have made tremendous impact. They include County Speakers Roundtable with civil society organizations, Governors Roundtable with civil society organizations, Public Oversight Institutions Roundtable with civil society organizations, that is Ethics and Anti-Corruption Commission, ESCC, Commission of Administrative Justice, CEDGG, National Lands Commission, NLC, Independent Policing Oversight Authority, IPOA, and Kenya National Commission on Human Rights, KNCHR. Speakers Roundtable forums have provided a platform for budget discussions between county assembly committees and CEDGG. This forum yielded a budget day with the county assemblies in Baringo and Nakuru counties.
Every time we have a budget day, we do it together, and the entire process of budgeting. We bring out those issues so that they have a way. They also try to balance how they present the information to members of the public.
The budget day is a day which is set aside so that the committee can get the views of civil society organizations on various memoranda they've presented, so that they can critically present the issues that they are raising.
Governors Roundtable is a forum organized by CEDGG to provide CSOs an opportunity to ask the governor and his cabinet questions arising from the implementation of approved budgets at the ward level.
Specifically with CEDGG, with their structures, community being a part of it, they conduct their exercise on social accountability, which they are sharing with the leadership through a forum, that Governors Roundtable, and again they have been engaging individual departments like on the area of water, health and education. There is a way they have always done their exercise and at least share their reports. As an office, we have been using it to improve, and it has really helped us as a government through implementation.
CSOs are doing a very commendable job, and those who may not understand, they may take it negatively, but for us we take it very positive, because that is their role, just like for the estates or the media.
Public Oversight Institution Roundtable, in collaboration with civil society organizations, has served as a key advocacy tool in the budgeting process.
Occasionally, on a quarterly basis, we sit down and discuss the human rights landscape in our counties, the accountability landscape in counties. And one of the things we are so proud about is that in 2019, ESCC was able to recover a number of parcels of land that had been grabbed from Nakuru, and this was a result of reports that had been shared by our community oversight forums to ESCC.
Nakuru is the third largest county based on population and is a major tourist destination. 60% of the population in Nakuru lives in an urban setting, and like in many urban areas in Kenya, access to health, water and social amenities is a challenge. Jessica Wamboy is a porridge vendor in Bondeni, Nakuru town, and a gender-based violence survivor. She started selling porridge to support her family after escaping from her violent marriage.
Tuliachana na yeye kwa sababu ya vyangu. Wako anaamini ati naweza change, naweza toka kwa street na nikae kama mimi, kwa roho yangu nilikuwa nimeamua nikae kama bibi na change tukae kama bwana. Lakini yeye alikuwa ananijudge tu na life story yangu ya nyuma. Alikuwa anaona sasa huyu ametoka kwa street bado ako na zile mambo za street. Unasikia tu amekugonga. Kitu kidogo hata makosa yenye si ya kukupiga anakupiga. Na anakupiga na make sure amekutoa damu. Wakati nilikuwa nakaa na ule mwanaume alikuwa ananilipa hata saa zingine vita na nyamazia mambo kama hizo. Mimi nilitoka pale kwake, nikaanza kupika uji na chapo, na amka asubuhi saa 10 napika chapo na uji. By saa 1 nimetoka naenda nazungusha, napata 500 yangu ama 300, nimeiweka kwa chama hiyo pesa. Sasa hapo ndo napata mapato yangu kulipa nyumba, school fees, mambo kama hiyo.
Today, Jessica is using her venture to improve the lives of fellow gender-based violence survivors.
Mimi naweza ambia wamama kitu ya kwanza, ndo washikane na mtu, ni vizuri kujua huyo mtu ni nani. Na kitu ya pili, asikae mahali penye ana feel hapo mahali hapamfai. Usijilazimishe kwa mtu. Usikae mahali penye unafusiwa na usiogope. Jikubali tu vile viko.
We engage with the community down there. We engage with the social protection working group. we engage with a civil society organization or forum. At the community level, we empower them to understand their rights and also to understand the spaces that they can occupy to advocate for realization of their rights.
We came together as partners and we had a capacity building on how to really have a standard operating procedures in helping a survivor, particularly women and children. So basically the cluster was formed so as to respond to a need or a gap that was there in trying to standardize the operations of gender-based violence prevention and response among partners within Nakuru.
So through us, CEDGG as convened, we have the county technical working group and we have the Nakuru Town East and West subcluster technical working group. So CEDGG has been leading in convention of the meetings.
We have receiving calls in terms of referrals. Yeah? We are seeing government officers coming to our center to be helped. Initially we just thought that serikali haina shida, yeah. But we're seeing police officers coming, we're seeing teachers coming, we're seeing medical officers coming to our center to be helped to pursue to access justice.
In pursuit of access to human rights and justice for vulnerable and marginalized groups, CEDGG has established the Nakuru Legal Aid Center that is set to become a model one-stop shop for provision of legal aid services and best practice in coordination of legal aid providers.
We monitor cases of human rights violation and document them as well. And then after, of course, documenting these cases of human rights violation, we report to the relevant authorities. Also engage with the relevant authorities like the CUCs, court user committees, the legal aid providers working group, and even, of course, the entire judiciary on matters access to justice, and come up with possible solutions with regard to human rights challenges that are experienced in the communities that we work in.
Notably, Rongai Leakwara, a woman living in a predominantly patriarchal society, is a budget champion. Rongai, who is also living with a disability, has defied odds to continue championing for the rights of her community.
Ile imenisaidia ni kwamba niliweza kujijua. Ya pili, niliweza kujua haki yangu kupitia CEDGG kwamba mimi niko na right ya kuweza kusimama na kusema miradi fulani itekelezwe kulingana na vile wananchi walipoweka bajeti. Jukumu langu imekuwa ni mimi kufuatilia miradi ya maji kwa sababu tulipokuwa katika bajeti tuliweza kuweka pesa ya miradi ya maji. Uongozi ni sisi wote tukijumuika na waume kwa wake tuweze kuongoza taifa hili.
The space of decision making. What we want in these spaces, be it when the assembly is making laws, when government is preparing budgets, what we wanted to see is that the space adheres to the national values and principles of governance, that the space is inclusive, the space is participatory, the space promotes equity, there is prudence in the kind of decisions going to be made, and that's why we are pushing for even more justifiable decisions.
In Kapkuikui, Baringo County, women are breathing a sigh of relief. They no longer have to walk long distances in search of water. Due to their consistent participation in the budget-making process, water projects were completed, and today they enjoy piped water at their doorstep.
Tulikuwa tunatumia the stream ambayo ni canal, which maji yake si safi. Maji ni contaminated. And then the distance from the canal to the households ni mbali. Unaweza pata mtu amebeba a distance of like 7 kilometers, 8 kilometers na ni mgongo.
Na wakati huo tulikuwa tunatembea, tunashika punda, tunafungia majerikani, tuko na watoto kwa mgongo, kwa na mbuzi unataka upeleke kwanza, tunaenda mpaka huko tunachota hiyo maji.
Sasa ile faida sisi tumepata huko juu, maji imekuwa karibu, wengine hata wameshapeleka mpaka nyumbani kwao. Sasa hiyo at least wamepunguza hiyo gharama ya kutembea tembea. Imesaidia hata wakongwe hawaendi mbali sana.
Magonjwa ya maji zimeweza kupungua kiasi. Nakuta sasa watu walikuwa wanapata kolera ile maji ya swam, lakini vile hii mradi ililetwa hapa, sisi tumefurahia sana kwa sababu hiyo ugonjwa imeenda chini sana. Alafu hata meno, hii rangi yenye sisi tulipata kama wazazi, watoto sasa at least hao wana hii meno nyekundu kama yetu, hii fluoride imepungua.
Vile wakaaji Kapkuikui walienda kwa public participation, akaonelea hii village ya Lokuru ipate maji, wapewe water kiosk ya maji, na tukapambana mpaka sasa imejengwa.
Wakati maji ilivyoingia, tunaona kama vitu mingi imeenda. Tumeingia sasa kwa Kenya, lakini otherwise tulikuwa kwa mahali pengine hatari.
Water projects, we are able to adequately ensure that the community prioritize the projects and allocates an amount that is commensurate with the works that are meant to be done. So that is another area where CEDGG has really come in handy.
The CEDGG model of working with budget champions at the community level has seen the county and national government become more responsive.
Kwanza imesaidia kwa sababu hawezi poteza muda kuchakua miradi. Kitambo serikali wakicha na viongozi wao wakuja kiti hapa, wanachukua the whole day kwa sababu watu wako na shida mingi sana. So imesaidia serikali kwa sababu especially county, kwa sababu wakikuja tu sisi ambao ni champion tumejipanga, wananchi wamejipanga kuona kwamba yale ambayo tunafanya yana manufaa katika wananchi.
We are seeing projects that have been installed are now operational. We are seeing communities that they do not have social halls, they do not have dispensaries, they do not have ECD centers. By them being actively involved, for example, in the budget making process, those facilities have come up.
We have seen improvement, including increasing of staff in some health facilities that were really understaffed. So we've seen very responsive government, especially the sectors where we have worked with, water sector, health sector, agriculture and education, because they have seen value in improved service delivery.
CEDGG believes that building the capacity of communities empowers them to participate in local development and demand accountability from government, which in turn improves service delivery through systems created by both the government and CSOs.
When we have the budget speaking to the concerns and the priorities that are raised by young people, it means that even young people can have their issues well articulated. Yeah, it's an opportunity for them to use social accountability spaces and approaches to, of course, see their needs being addressed.
We organize communities basically using a number of models, and the social auditors, we have community social auditors, we have community scorecard committees, we have community oversight committees or forums, COFs, and sometimes we've even become sector specific.
CEDGG has been very instrumental. It's one of the few organizations that have done social audits on the impact of projects in the county government.
The various approaches used by CEDGG have registered improved citizen engagement and built confidence as citizens witness the county government taking their community priorities into consideration more frequently.
Kitambo kwanza daktari alikuwa anaendanga akikujanga, ikinyesha barabara ilikuwa mbaya, kama sisi tukigonjoka tunaamua kwenda Marika tuchunge mambo ya insecurity. Sasa ilikuwa shida, daktari kwa wiki alikuwa anakuja mara 2 ama mara 3, na shida ya hapa hata tunaandikwa dawa tunaenda private, tunaenda kununua kwa private. Na kwa maana kama una pesa unafadhalisha kuandikia dawa uende ununua kwa bei ya chini, lakini kama uko na pesa utaenda hospitali, na ukienda hiyo hospitali ya private inachukua 2,000 haya plus pikipiki 100 kwenda na kurudi. Unaona ni changamoto ni mingi. Daktari alipokuja yeye ana hata kama ana stima, yeye anashughulikia watu yake 24 hours, hata kama ni weekend. Hata Jumapili nikienda nikiwa mgonjwa, yeye anapokea watu hata ukienda saa 12 asubuhi. Haisi sema enda mpaka saa 2 nikuje niwashughulikie.
Kuna mabadiliko ya kwamba tumekuwa na madawa, ile tunapigania tuwe na dawa. Nimeona wamama wanasaa kwa hospitali kwa ukaribu. Nimeona hata na watoto wanatibiwa kwa ukaribu. Hata sana sana tunaona kama kuna malaria, tunapimwa malaria, tunapimwa HIV na ni free, na matibabu yote tunapata ni free.
CEDGG wameleta manufaa kubwa sana, kwa sababu sisi hatukuwa tunajua mambo ya budget inaendaje. Sisi tulikuwa tunaitwa tu baraza na tunaenda. So imeweza kutuelimisha ya kwamba uamuzi mkubwa inatoka kwa wenyeji ambaye ni citizen. Ya pili, wametupea hata ile knowledge kama social auditors.
Or Sireta dispensary, when we came to Sireta dispensary was built long time ago. As a county government, we came and renovated, and we built a nurse staff house.
On 26th April 2014, that's when we had a county budget and planning meeting for projects, and we identified this Rajuera. So we lobbied, we were given like 7 million for dispensary, and we said we need what we call running water to support this facility. That borehole was to support this facility, and it's good that now we have water here serving the facility and the communities surrounding.
We've achieved a lot. One is the birth of this facility, and even we have a primary school across, Kambiamoto Primary. It is through the civil society who have actually gone ahead and ensured that the school is secured and owned by the school.
Sema nikiwa mkaaji wa hii kijiji, mimi ni mwanabiashara na wakati mwingine nabeba na bodaboda. Mimi huwa naleta wamama wengi hapa. Wananiambia wanafurahia hii huduma kwa sababu zamani wangeenda Nyeri ama waende Nyahururu. Sasa unaona matibabu ikaanza kuwa karibu. Sote tukafurahia.
Sasa sisi kwanza kabisa CEDGG walikuja wakafunza community. Kazi ile kubwa kwanza ilikuwa ni kusomesha jamii vile wanavyofaa kujishirikisha mambo yanayowahusu wao wenyewe, kuelimisha jamii yenyewe, kuwafanya waone miradi ambayo ni yao. 2016 ndio tulifanya social audit ya kwanza ya homeland.
From the social audits, we have seen most of those issues which have come up. When the budgeting is being done, we've realized that some of those issues have been prioritized.
Primary health care has really improved. We have pushed government and also even pushed allocation of resources to establishment of community health units. Every day there are new community units with a host of community health volunteers being established and even being strengthened through trainings. Beyond expanding the number of facilities, we have championed for expansion of services such that you don't need to travel to the nearest sub-county hospital, but instead you get as much services as possible from the dispensary, including emergency deliveries. If you go to the statistics, you will realize that an infant mortality has reduced due to improved service delivery at level 2 facilities.
CEDGG intends to include more stakeholders drawn from all groups of the community into the budget process for an even greater impact.
As an organization moving forward, we are training the budget champions as TOTs to replicate these models in the other counties, and even at the ward level, and even at to the extent of the decentralized units, the village level, and the stakeholders are represented therein. That's where we are talking about now establishment of cells, community budget cells, community scorecard cells, social audit cells, so that the conversation down there is quite informed and is one that creates the pressure and the atmosphere for implementation of the ideals of the Constitution of Kenya.
And with such resolve, CEDGG is on the trajectory to becoming the most credible regional voice in the budget-making process, not only in the Rift Valley regional block, but also extend their services to neighboring counties, eventually covering all the 47 counties in Kenya.
Whenever we involve young people, especially in social accountability processes, we are going to strengthen their resilience in terms of them, of course, accessing good services, in terms of our policies and our needs being responsive and taking into consideration the unique needs that we have. So there's a lot of potential in that space.
Going forward, we would want to the support of CEDGG so that we can have continuity of programs that we are running in the Assembly, and to ensure that the Assembly achieves its mission and vision and delivers on its mandates of legislation, representation, and oversight.
We intend now to move regional. We've already started an experiment of the Rift Valley Regional Budget Hub. The civil society network is a good model. So the plan is to have the civil society forums across all our counties.
Through strategic collaboration with the other non-governmental organizations and even government included, we believe that we'll be able to improve and expand our capacity to reach out to the needs of our target groups.